Hello guys, welcome to Dr. Science. So we are starting series about the general surgery, and today we are going to mainly talk about the classification of wounds. Okay, so in classification of wounds there are types. First we will talk about the class 1 wound. What is a class 1 wound? Class 1 wound is a clean wound. Now what is meant by this? It means there is no entry into gastrointestinal tract, genitourinary tract, or the respiratory tract. Hence we say there is no contamination, because normally the gastrointestinal tract or the GUT or the respiratory tract is having a lot of bacteria, and this bacteria can spill into the circulation. Okay, that's why if there is no entry into the GIT, there is no contamination. Okay, now what is the example of a clean wound? Now imagine there is a radial fracture. If there is a radial fracture, we are not going to open up the GIT or the GUT, okay, because it is simply a radial fracture and it does not require a surgical exploration. We simply place a cast on the radial fracture and stabilize the bone. Hence this type of wounds are called as your clean wounds. Now what is the risk of getting a surgical site infection in class 1 wounds? The risk of getting surgical site infection is nearly 1 to 3%. Okay, I hope you are clear with this. Next we will talk about class 2 wounds. Class 2 wounds are said to be clean but contaminated wounds. Now what is meant by this? Here there is entry into gastrointestinal tract, genitourinary tract, or the respiratory tract. Hence we say that there is contamination. Now what is the example here? First, one more important thing is that there is no spillage. Now what is meant by spillage? Suppose this is the liver and here is your gallbladder. Now this gallbladder, we are going to perform an operation called as cholecystectomy. In cholecystectomy, we are going to remove the gallbladder. Okay. Now while removing the gallbladder, the surgeon was careless and eventually there is perforation of the gallbladder. Whenever there is a perforation of the gallbladder, the contents of the gallbladder will leak out. The contents of the gallbladder, such as your bile, will leak out outside. Now this is called as your spillage. Now what is as you can see here, in class 2 wounds there is no spillage, but we are going to enter into the gastrointestinal tract, hence there is contamination. It means some of the bacteria can enter into the circulation. Okay, now what is the risk of getting surgical site infection in these people? It is nearly 2 to 9% of getting surgical site infection in class 2 wounds. Now let's talk about class 3 wounds. Class 3 wounds are considered as your contaminated wounds. Now what is meant by this? It means there is entry into gastrointestinal tract, genitourinary tract, or the respiratory tract. Hence there is contamination. And not only that, the most important thing here is that there is spillage. Okay, now the most important thing also here is these type of wounds are considered as your fresh, accidental, injuries. Now, what is meant by this? Imagine a person is going on a bike and this person is going nearly 100 kilometer per hour. Okay, and unfortunately this guy lost balance and he fell down, due to which there is accidental injuries. Whenever there is accidental injury, we say there is breach of asepsis. Now, what is meant by breach of asepsis? Normally, most of the operations are done in operation theaters. Now, these operation theaters are sterile. It means there is less bacteria. Now, imagine this patient is struggling on the road and we have to do an emergency operation on the road itself. Now, this is called as breach of asepsis. Because on the road there is a lot of bacteria present and this bacteria can lead to contaminated wounds or type 3 wounds. Okay. Now, what is the risk of getting surgical site infection in type 3 wounds? It is nearly 3 to 13%. Now we will talk about class 4 wounds. Class 4 wounds are called as your dirty wounds. Now, what is meant by this? It means there is perforation, plus there could be entry into GIT, GUT or the respiratory tract, plus there is contamination, plus there is spillage, and not only that, there is perforation. Now, in order to understand this, I will draw a small diagram here. So here is the cecum. Now the cecum is having the appendix. There is a condition called appendicitis where the appendix is inflamed. Now this inflamed appendix will eventually perforate, and this perforation can lead to spillage of bacteria into the peritoneum. Okay. Now this type of wound is called as your dirty wound or type 4 wound. Now, what is the risk of getting surgical site infection in a type 4 wound? The risk is nearly 13 to 30%. So that was about class 1, 2, 3 and 4 wounds. I hope you understand this topic. Thank you guys.